Hello everybody, welcome to the Thursday edition of Video Clips, and I just want to mention something really quickly, and that is that February is the beginning of our advanced study program. These are two-hour sessions a month with me, and I picked for a topic in February, Whole, Rethinking the Science of Nutrition. I know some of you have read the book. You might want to have a deeper understanding of it and how to use it. Some of you have not read the book, and maybe you'd like to have a better understanding of what's in it since you haven't read it. But anyway, February 4th and February 25th are the dates. They're 2-hour sessions. I'm going to send you slide presentations and materials to keep. We'll record the call and hold it for a little while so people who can't be on the calls live can even listen to the recording. So if you're interested, this is open to members and non-members. Just contact the office and we'll be happy to provide you with details. And I hope some of you will join us because I think this is a great opportunity to learn from this book. And I'm frankly looking forward to reading it again because every time I read something Colin Campbell writes, I learn something I didn't know the last time I read it. So I've read everything he's written a bunch of different times. Okay, picked a couple topics we need to talk about today. One is treating hypertension. And according to a new report published in the Journal of the American Medical Association, doctors have been over-medicating older people with high blood pressure. Oh my gosh, I've been saying that for 17 years here. The new guidelines, prepared by a committee of 17 academics, stated that people over the age of 60 should not be medicated until their blood pressure reaches 150/90. Now, I state, and I think the evidence is clear about this, that it's better not to medicate until blood pressure reaches 160/100 and doesn't respond to diet and lifestyle change. And those are the parameters for the British Medical Society, by the way, or Hypertension Society. But at least this is a step in the right direction. Any acknowledgement from the medical community that we need to be more cautious about medication, I think, is a step in the right direction. Now, prior to this report, guidelines recommended that patients should be medicated to achieve goals below 140/90, and multiple drugs were often used in order to achieve those objectives. The committee acknowledged that there was insufficient evidence to support this practice any longer and that patients were at risk of experiencing side effects and harm from the medication. And what I think is a stunning admission, the committee stated that there's a difference between lowering blood pressure with drugs versus doing it naturally, since the side effects of the drugs often counteract any benefits that they might provide. In fact, according to a study done in 2006, the more aggressively blood pressure is lowered, the higher the death rate. The way blood pressure has been treated historically in our country mirrors the way that many conditions have been treated. If some medication has a positive effect, more must be better. If more medication doesn't achieve results, do combination therapies and add more drugs. And for some biomarkers, the targets keep changing, resulting in more and more people being diagnosed and then much more aggressively treated than they would have been had they been visiting a doctor 10 years ago. This happens not only with blood pressure, but with things like glucose levels, thyroid markers, and many other conditions. And the problem is the evidence just doesn't support this aggressive approach. The committee didn't change its goal for the people under the age of 60. I think it should have, but and I don't think that the evidence supports their treatment guidelines for people under the age of 60. The authors do acknowledge that half of people taking drugs for hypertension under the age of 60 don't achieve their blood pressure goals as a result. But still, in spite of the limitations, this represents progress, and more attention's being paid to the negative byproducts of diagnosing everybody with something and treating them with medication. The New York Times covered this issue, which brings even more widespread attention to it. And I know it's been very frustrating to watch this from my perspective. It seems like the health profession is very slow to catch on. But with publications like the New York Times publicizing it, maybe we'll just teach the patients to say no if we can't teach the doctors to not do these things. Which brings me to another thing that the New York Times covered, which is Dr. Gilbert Welch talking about mammography screening. Now, I'm a big fan of this guy. He's a medical doctor. And through his books and lectures, he's becoming the voice of reason, pointing out the harm that results from excessive screening, overdiagnosis, overtreatment, and just too much medicine overall. The Times featured an editorial that he had written. And it's all about informed decision-making. Welch is an advocate for that, and he says it's offered, and I agree, to too few patients in too few situations. He states that most people are told that any type of screening is the most important thing they can do to save their lives. Very few people are told that it might be dangerous. Welch thinks that in order for people to decide, they should be given a balanced view, the benefits and the harms clearly quantified. And so he and a colleague did this in an article published in JAMA Internal Medicine, and then he based his editorial in the Times on the data from that article. Welch says that there's a lot of uncertainty and disagreement about mammography, and his article attempts to provide, quote, a wide range of estimates ranging from the optimistic to the pessimistic. Frankly, as you read this, I think most of it sounds pretty pessimistic when it comes to mammography. According to Welch, if 1,000 50-year-old women are screened annually for 10 years, between 490, this is the optimistic projection, and 670 of them will have at least one false alarm. These data come from the Breast Cancer Surveillance Consortium, which represents the mammographers themselves. This is a stunning admission from people who actually do the test. And Welch agrees, states that a screening test with a track record like this, where at the best case scenario, 50% of the people get false positives and experience significant fright due to these false alarms, it's just outrageous. He also discovers overdiagnosis, or the tendency to call a pseudo-cancer, like ductal carcinoma in situ, cancer, even though it almost never develops into that. Welch says there's no longer a debate about whether or not this is happening. The debate is about how frequent it actually is. Now, in the United Kingdom, things are made a little bit more clear to patients. The National Health Service has developed a brochure about mammography in which it states that the chance of an overdiagnosis is 3 times higher than the chance of avoiding death from breast cancer. Welch agrees with this, stating that his estimate is that if 1,000 women are screened every year for 10 years, between 3 and 14, the wide range, by the way, is his optimistic, pessimistic diagnosis. Between 3 and 14 will be overdiagnosed and overtreated, while between 0.3 and 3.2 women may avoid a breast cancer death. So to summarize, let's just look at the benefits and harms from mammography. You screen 1,000 50-year-old women for 10 years. 0.3 to 3.2 will benefit. 490 to 670 of them will have at least, this is as high as 67% will have at least one false positive, and between 3 and 14 will be overdiagnosed and overtreated. It's just hard for me to fathom how we can continue to spend billions of dollars annually on this test and not only encourage, but harass women into having this done. So once again, the encouraging thing here is mainstream publications are starting to publicize this, and maybe we'll just teach all the patients to say no, and that'll dry up the demand, and we won't any longer have to worry about what doctors recommend. Okay, that's it for today and for this week. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you again next week.